Okay, thank you. Thanks everybody for joining us this evening. We have Dr. Grace Fryer and Vicki Swinehart, our Director of the Health Department in Seneca County. And the purpose of our meeting tonight is to listen to our experts talk with us about return to play related to COVID-19 infection. This is something that was introduced to the district just recently within the last few weeks. And so I want to recognize Crystal Kent for all the work that she's done, preparing the postcard, getting it sent out to all of our families, coming up with their return to play protocol for all of our PE teachers to use when kids return from having tested positive for COVID-19. So it's been a heavy lift and Crystal's done a great job, and we're all very appreciative that she's taken that on. So if we could start with introductions. Dr. Fryer, if you'd like to start.
Yep, Dr. Grace Fryer, I'm a pediatrician.
And Vicki.
Vicki Swinehart, I'm the Director of Public Health for the Seneca County.
And Crystal.
Crystal Kent, the Director of Health, PE, and Athletics.
And I know Tim Lincoln is in the background. Thanks to Tim for getting this call set up. And Cindy Wright will be our facilitator tonight from reading questions in the chat. Everybody's microphone is muted except for Dr. Fryer's and Vicki Swinehart's and Mrs. Kent in case she needs to answer questions for us. And also Mrs. Wright because she'll be reading the questions in the chat. So if you have a question about anything in the presentation or anything around the topic of COVID, we certainly have our regional experts in this call this evening. And if anybody's going to know these answers, these two ladies will be the ones. So feel free to answer questions or ask questions at any point. And I know we have folks from other districts that have joined us. Thanks very much for being part of the call. And hopefully we'll all learn a lot tonight. So is there anybody else that I didn't introduce before we get started? Okay. All right, so I will attempt to share my screen and the PowerPoint. See how it goes. Is the PowerPoint up?
Nope.
No, not yet.
Must be loading. I can see it on my screen. Try again. How about now?
No.
Okay, so is there some magic to this that I'm missing? Click green share screen button, right?
Yes.
Okay, and then click on the document. One participant shares at a time. Okay, so that's what I've got.
There you go.
Ah, third time's a charm. Excellent. Okay, Dr. Fryer.
Okay, great. So this will be an overview of the return to play after a COVID-19 infection. This will affect grades K through 12. Initially, this affected mainly the middle school through the high school, but recently we've added all the kindergartners as well, at least for PE and other activities as well if they're doing outside sports. All right, we'll go ahead and go to the next slide. So basically all students have been infected with COVID-19, whether they're symptomatic or not, to require at least a 10-day resting period. You must be completely asymptomatic for at least 1 day, no fever, without medication, before returning to exercise and or competition. This allows for the actual COVID-19 disease to manifest itself fully and to give also a period of rest before they go back to their activities. After this infection, after they're cleared from isolation, they must be seen by their primary care provider and to be cleared, and we have some paperwork I'll show you at the end that needs to be filled out or just used for this participation clearance. The reason why we're talking about a return to play after COVID-19 infection is COVID-19 is not just a respiratory illness. Lots of other organs are affected. Cardiac being our most important one we're talking about tonight, but neurologic, hematologic, your blood infections, your blood pressure, your renal, with your kidneys, and gastrointestinal. So you've seen all sorts of manifestations, and of course respiratory. I didn't put that in there, but we all know that's how it starts off. And of course we know about all the different symptoms. We're looking for headache, nausea, vomiting, chills, chest pain, shortness of breath, and those are things we're looking at while we're looking for infection. But afterwards, we do know that it can affect all those systems. The good news is majority of the children are mild, and it does look like a regular viral cold virus for most of the kids, especially the younger cohort. So it's just a very beneficial thing for our students. Next slide. The main concern we have is a cardiac concern, especially when they go back to activity, because this viral infection does affect the heart. It can cause a myocarditis. This is a viral infection of the cardiac cell causing inflammation. It can also cause a pericardial effusion, interfering with the heart pumping in its sac. It can also cause tissue scarring, which gives you risk for arrhythmias. And this is where we talk about that sudden cardiac death that we see on the gym floor that we are trying to avoid. So the good news is we can screen. Number one, we want to make sure we identify who's at risk. The most recent infection, the closer you are to infection, the closer you are at risk, or the severity of the infection will make you more at risk. And of course, if you have a cardiac history, then that will give you a higher risk. So the screening allows you to give adequate time for recovery and to assess their risk factors, and also, lastly, what kind of activity they're going to be going back to. So next, the main things that we're going to be looking for by their primary care provider will be, do they have any chest pain with exertion, whether it's just walking or going up down the stairs, shortness of breath, extreme fatigue after any kind of exertion or exercise, palpitations during, and of course syncope, which is passing out due to any of those factors, or just an inability to stay upright while you're exercising. The next slide is the form that we're using, and it could be electronic or it could be the paper form, which is fine. Our office does have an electronic version of it, so we can print it out from our electronic medical record. So mainly we're going to identify when they were when they started having their symptoms, when they had their positive test, how long they've been, from their, I'm going to actually pull it out so I can see it in front of me, the form. When they had resolution of COVID symptoms. And then we're going to look at whether had a mild disease, moderate disease, or severe disease. So the symptoms were less than 4 days long, whether it's fever or extreme fatigue or any of the main manifestations of their viral illness, then it's going to be considered mild disease. If it's longer than 4 days, we'll consider it moderate. If they're hospitalized, they can be considered moderate to severe. And of course, if they have a history of any cardiac abnormalities followed by cardiology, we want to know about that. And then we talked about those other symptoms, chest pain, shortness of breath, fatigue, and syncope, yes or no with exercise. Then your primary care provider is going to actually listen to the patient's heart and make sure the blood pressure is normal and decide whether or not they need a cardiology referral. If there are any of these symptoms are concerning, they will require a cardiac referral. And then if they're cleared with negative symptoms, then they can start their gradual return to sports. Go next slide. And we just briefly mention this. So a positive cardiac screen is going to be a answer to yes of any of those symptoms we talked about or asked about. And it's possible that your primary care physician might want an EKG right away, or have the cardiologist go ahead and do it then. They are not allowed to start sports until they are cleared by the pediatric cardiologist if they have any positive symptoms. That being said, I had a patient come in and it wasn't a cardiac concern, it was more of a respiratory concern, and we are just at that point are going to wait for that respiratory illness to resolve before we continue the clearance. So mild cardiac symptoms we talked about. And if you have mild cardiac symptoms, we're not worried about getting an EKG, a cardiac referral. This, just like most of the patients or students or children who've had COVID, it is going to be quite rare to have a cardiac significant injury. So they are going to go back to a return to play, but it's going to be gradual. Just like anybody who doesn't do sports for 2 weeks, it's going to be hard to go back to a full game in a tournament without being building up to that. So we want them to build up their endurance and their tolerance back to sports after regular illness. This next slide is going to talk about the actual protocol that we're using, and it's a flow chart. Again, they need to be 10 days after their positive test, asymptomatic. It talks about mild and moderate disease. Most people are going to be in the mild symptom, which is what our community and our providers will be looking at. They'll get an evaluation. If they're negative for any residual problems, they'll do the gradual return to sports. If there's a positive screen, they'll go to cardiology. You can see abnormal EKG and echocardiograms with the myocarditis, so they'll do the test. If it's abnormal, they'll continue to follow until it becomes normal again. So severe disease will already have an established cardiologist following them within the inpatient hospital stay or in the ICU, and they can present with hypotension, intubation, any kind of abnormal labs, or will be diagnosed with multisystem inflammatory syndrome. And so obviously we're going to assume that they've had a myocardiac involvement, and they'll be restricted from exercise for at least 3 to 6 months. Again, they'll have their EKG, the echo, and then repeat that until those are normal, and they'll be cleared not by their primary care provider, but by their cardiologist. So once they are cleared by their primary care provider, they can start their regular daily activities, walking, going around the house, taking a walk, going up and down the stairs. And as long as they're able to do that, they should be seen by your provider, and then hope get cleared to do sports. So the gradual return to play is pretty much a 7-day progression, just like your concussion return to play protocol. The first day is going to be just low impact, lightly walking, jogging, stationary bike for less than 15 minutes. Just like you start any kind of new activity, you want to gradually build up. So that's going to be 2 days. The next stage is going to be a higher intensity activity, including drills, and that's up to 30 minutes. The next stage would be up to 45 minutes of complex training, more complex drills. Whether if they're doing sports, they can do, whatever, passing the ball back and forth, light resistance training, maybe even, small scrimmages within their team. And then stage 4 would be pretty normal, your regular high intensity activity up to 60 minutes of training. You want them to do that at least twice before they get cleared completely. So once they do the stage 4 2 times without having any symptoms, they're clear to go back to competitions. If they do have at any point have symptoms, and we'll talk about those symptoms in one of the next slides, dizziness, extreme fatigue, shortness of breath, inability to continue, then they need to stop. And if it's very intense, they'll go back to see the regular primary care provider. But if it's something where they can just rest and recover, they'll go back to that prior stage where they didn't have symptoms and then start over. It just might be a prolonged or gradual return to play. And again, dizziness, difficulty breathing, chest pain, pressure, fainting, or decreased exercise tolerance, they're going to stop completely and then go back to see, discontinue activity and go back to see their primary care provider. If they're just winded because they need to, slow down, that would be something that you and the student, including and the gym teacher and the coach, can evaluate. Take a break, see how you do, drink of water. Just like anybody recovering from an illness, it may just take them longer. All right, now these are going to be different. Again, this all being said, it's not going to be, we are going to have to use some good common sense because it's going to be different from a 7-year-old going back to playing basketball in gym than it is going to be from an 18-year-old varsity player playing basketball in a tournament. So, the higher intensity, we're not going to expect the 7-year-old to work nearly as hard as you would expect the varsity 18-year-old. So, we're going to have a little bit more grace for them just playing than it is to be more vigilant about the intensity that we're using for the high school students. It really is the adolescents and the high school students that are at higher risk for a cardiac injury than the younger students, because most of the younger students are, their activity that they do in gym and sports are not higher than they would do with just playing. All right, any questions at all?
Nothing in the chat yet.
Now, as far as I'm concerned, when I evaluate a student for return to play, I make sure everything's negative. They have negative history. They're, haven't had any problems at home or walking or jogging or anything like that at home. And then I'll write a note to the school nurse saying he's cleared to return to play. Sometimes I do send in the actual form, but I think as long as we indicate that we've assessed them and their cardiac screen is negative, it's not necessary that they have that form, although it's nice. It could just be that they're cleared for the return to play.
Okay, our first question is, will doctors be informing parents that they will need to return for clearance when they are diagnosed with COVID?
So this is part of the information that we're trying to get to all the parents, is that sometimes the positive screen does not come from, the results don't come from the doctor. It's the screener who's calling the patient and telling them they're positive, or it's the health department that's telling them, and we're more interested in keeping them isolated than they are those 10 days later. So oftentimes if I have a positive patient, I will tell my nurse to make the appointment for them after when they come out of isolation. But that's something we definitely want the school nurses to help facilitate and inform the parents, as well as just make it a more public known event that we do need that form. And if they go back to school, that's fine because they've been cleared by the health department, but the nurse will say you're not cleared for gym, so we need to see their regular doctor, and that's okay too.
Okay, the next question is, do they need final clearance by PCP after completing the stages, or can this be completed by the RTP team and school nurse?
So the RTPT team, is that the athletic trainers that we're talking about? I'm not sure.
I'm not sure either.
So they have to be cleared by a provider, because a provider has to listen to the heart and lungs. They have to be seen, in an office, if at a certain point someone has lost their health insurance, or they're new to the system and they had COVID, and they lived in Florida and are coming here, then definitely your school physician, me for Waterloo, and we have other providers for other school districts in the area, can do the screening. But it is always better for them to go for their PCP. I think we're kind of pushing that, number one, because we don't want people congregating in the nurses' room, and we definitely want to continue social distancing. And number two, if there is a positive screen, the school provider can't make any of those referrals. It has to be done by their PCP. So it definitely can be done, but we are pushing for the PCP, or even if it's just somebody in their office, doesn't have to, it could be, I would probably leave urgent care out of this because they're just overwhelmed. But even if it's, a mid-level, or where, in the same office that you haven't seen before, they can definitely evaluate your heart and lungs. We're actually not in any rush. Giving the student more time to recover is probably better than to say they got COVID, it's 10 days later, they haven't had a fever for a day and they want to start basketball tomorrow. It's probably better to wait and have them build up, even if it takes an extra few days.
The next question is, if we take our child for a physical, do the local doctors have the return to play form, or do we need to get it somewhere?
So our office does have it. It's been distributed regionally as well. So, and if they don't have it, the nurse can send it home with your student.
Crystal just answered the same thing and just wrote, at Waterloo, we're mailing home the paperwork once we know there's a positive, so the families will have it when they go to their PCP.
No.
No other questions right now. One just came in. Will this be protocol for any other illnesses like pneumonia, mono, etc.?
So no, just like any viral illness, we want to make sure that our student is not in school very sick and unable to participate in class. We don't want them very sick and unable to participate in PE or sports. So just like any other viral illness, cold, pneumonia, mono, they're going to be able to rest and then go back as tolerated. So most of pneumonia only affects the heart, only affect the lungs. Mono is more of a, doesn't necessarily affect the same systems as it does COVID. So this is more of the individual COVID specific problem. And so I don't foresee it ever really kind of going towards the other ones. Obviously for mono, it's going to be specific to that 4 weeks because we're worried about injury of the spleen. So it's and the liver. So it's going to be a little bit different.
Nothing else right now.
Any questions from the nurses who are on our Zoom meeting? And how about for the gym teachers and the athletic trainers? You guys are still working on it? Is there any other concerns or issues that we need to address? Because this is going to be a whole school, process.
Someone just wrote, thank you, Dr. Fryer, and the other medical staff for all you're doing and for our community. And then the next person said, can we utilize coaches to walk through the RTP process?
Okay, so with the return to play process, that's something the coaches should be informed about, and I think they're working on it with Crystal.
At Waterloo, we are not choosing to have our coaches involved with signing off on the process. Right now, we don't have in-season sports going on besides bowling and swimming. Also, some days they're in person, some days they're remote. So we felt that it was best to have our PE teacher or other school designee So today I worked in the fitness center with a student that we have in the return to play process, because it was after contractual hours, plus our PE teachers had meetings, so I went in there with them. Or a supervised parent is what we've chose to do at home. Our coaches are aware of the process, and we've been keeping them in the loop with everything, so that they know everything that's going on. They've asked lots of questions. I had a winter coaches meeting last night where we did touch upon it, but everything is so new right now that I was hoping for us to have this meeting to make sure things were firmed up. And today we were finalizing our return to play form that has now gone to Dr. Fryer. So that's where we're at. And the PE teachers, we've also met. There were a lot of questions there. They've been great. So right now the PE teachers are in the process of planning to have activities for each stage, for each level. Because like Dr. Fryer said, it's going to look very different at the elementary school than it's going to look at the secondary school. So when they get to stage 4 and it's 60 minutes of exercise, again, that looks very different for grade 1 versus grade 10.
Are there any other COVID-related questions? I know we have a lot of staff on the line, a lot of parents that might have other questions that maybe Vicki Swinehart or Dr. Fryer might be able to answer.
Well, you're very welcome. I'm glad to be here and be part of this community, and I'm happy to help. And hopefully we've answered some questions, or if you brought more questions, be happy to answer them at a later time through any of the staff at Waterloo. So stay healthy, stay safe, and we'll see you later.
We just did have one extra one.
Oh, we
Just
do have
came
one
in.
person?
Yep. We had Mrs. Hayden say thank you for Dr. Fryer and Vicki for all you do for our children in the community. And then we have a parent or someone that asked, are we going to start testing in the schools?
Well, that's obviously a school decision at this point, whether it gets taken out of our hands if we ever get designated as into a yellow zone or a orange zone or a red zone. That's up to the governor. I mean, our numbers are going up. It's very concerning. Our hospitalization rate is kind of at that cusp. So we have not been designated into one of those zones. So, you know, the health department, and I sent it to all the superintendents I've sent out, we do weekly testing for asymptomatic individuals, so people can sign up and get tested there, or for symptomatic, we can have them go to a drive-through clinic. So for testing, we're not going to routinely do it unless we really have to, but if parents or children, you know, parents want to get tested or have their children tested, that is certainly an option that is available.
And that's right at the county building?
Every Monday, right now, every Monday at the county office building from 9 till 12. I can tell you that our clinic for next Monday is already full. It gets filled up very quickly. I think we had 170 or 180 slots, something like that. And we will do that weekly until either the tests run out or there's no demand for it. And then Over Community Health also does a drive-through testing on Thursday mornings from 9 till 10. And they also do it at their Geneva site in the Thursday afternoons. I can't exactly tell you what time that is. And then in the email or the list that I had sent to the superintendents, which they probably shared with all of you, there is also another website through the Say Rural Health Network that if you click on that, you can sign up for clinics to get tested in other counties also, like Ontario or Yates. You don't need to be a resident of those counties to get tested. We're just kind of cooperating. The point is to get people tested if they want to be tested. And if you can't come on a Monday because that's when Seneca County has it, then maybe you can go on a Thursday if Ontario County has it. So you can click on that site and check for availability of testing too. And if you're symptomatic, you should be seeing your doctor.
Someone's asking, how long does it take to get the test results?
For the testing that we're doing at the county office building, it is a rapid test. It takes 15 minutes and individuals wait for their results and they're given the results when they leave. The drive-through testing that's done in Ovid is the PCR, which is the three, or usually around 3 to 4 days to get the results on that one.
Well, I'd like to thank Dr. Fryer and Vicki Swinehart for being with us tonight. We appreciate your time. We know you're working very, very long hours, and so we certainly appreciate you taking time to spend some time with all of us tonight. Again, for anybody who hasn't seen or didn't have a chance to get on tonight, this will be on our website, so you can let people know if they're interested in the information. It will be housed on the Waterloo Central School District website, the recorded version. So thanks again to everybody for participating, and especially to our special guests for being here and helping us learn more information about this.
Well, thanks for inviting us.
Yeah, our pleasure. We appreciate the teamwork. Have a good night.
Good night.